The silent killer. Are you aware of your numbers? Do you know your blood pressure reading? If you don't, you may be suffering from high blood pressure, which could kill you. Stay tuned and find out more about high blood pressure. High blood pressure is associated with strokes, heart attacks, kidney failure, and many other diseases. That's why we are spending some more time with Dr. John Shafenberg, who's a professor of nutrition from Loma Linda University. He has many years of experience here in the United States, overseas in developed and underdeveloped countries, and he is going to share with us his expertise on nutrition and hypertension particularly, but we're going to talk about high blood pressure as a rule. Dr. Shafenberg, tell us a little bit about this real problem of high blood pressure.
It's really a worldwide problem.
Is it that important?
It's very important. And since it increases these chronic diseases like heart attack and stroke, it's extremely important.
So we need to know about it?
Well, you see, there's a lot of people who don't know that they have hypertension because they've never had their blood pressure checked.
So it's a disease that one can have without symptoms?
Yes. And one of the problems is that if they have had it checked frequently, here they're 50 years of age, 55, and they still have normal blood pressure, they think they don't have to have it checked again, which is not true. Because those people have a 90% risk of having hypertension still in their lifetime.
So in other words, if one reaches an age, as you mentioned, of 55 or so, and has never had high blood pressure, that doesn't mean that you can't get it yet. It means that you're still at significant risk.
Yes, you are. So you need to have it routinely checked.
So this is the kind of physical examination that's required, just a blood pressure screening check on a yearly or a 6 monthly basis?
Yes, I think that should be done.
Right, I think that's very important to know the numbers.
Yes.
We talk about cholesterol numbers and good cholesterol, bad cholesterol. We should know the sugar, and very importantly, we should know the blood pressure. But isn't it important enough for me just to take some pills if I have high blood pressure? That solves the problem, doesn't it?
Well, the problem with that is that the pill will lower your blood pressure and lower your risk
Great.
of hypertension, but it doesn't lower it as much as if you had lowered it without taking the medication. So there's some adverse effects of the medication.
And most medications have adverse effects anyway.
Yes. So if you can get by with a lifestyle program, it would be better. But if you do need the medicines, then you better take them because, for example, with hypertension, your mental cognition deteriorates in time, and if those people take the medication, it decreases that decline by about 40 to 50%, the studies show.
Wow. So taking the medication is important not only for preventing the heart attacks, the strokes and the kidney problems, it also protects the brain from deteriorating more rapidly.
Right, right.
That's very important. What is normal blood pressure? You know, that's a very important question, and in my clinical practice people would often ask me that. I'd love to ask you, what is normal blood pressure?
Well, you know, it's changed from what it used to be.
Right.
They used to say 120 over 80 is normal. That's called pre-hypertension now.
Wow.
So they say normal is below 120, below 80 diastolic.
Okay.
But optimal is a new term. Optimal is 115 over 75 or lower.
Wow. And does this go through all the age groups?
Yes. Even though you're older, it doesn't mean your blood pressure needs to go up. It doesn't have to.
Because I remember when I was a student, and
100 plus your age.
120 plus your age
Right.
at the beginning.
Right.
And then they said, well, you know, that's the top reading, and, you know, there's the top reading and the lower reading. Right. But now for everybody, 115 is regarded as optimal for the top reading and 75 for the lower reading.
Yes.
Well, that means there's some work to do here, isn't it?
Yes, because so many people have it. There are about 13 million people in the world who will have this problem, you know, who need to do something about this. It's a big problem, worldwide epidemic.
Oh, there are millions of people with high blood pressure, and one of the biggest problems is, and you touched on it earlier, is that people are often having no symptoms at all.
That's right.
They initially don't even feel bad, or they don't realize they feel bad. They may be less tolerant or less able to do exercise. They become a little bit more short of breath, but they adjust to that, and they don't realize that there are problems going on. So
13% of the total deaths worldwide are due to hypertension.
That's what you have. 13% of the deaths worldwide.
Right.
And this would include strokes, heart disease, kidney failure. So this is a major problem that we're dealing with, and it's a major public health issue as well. And I think that you've pointed out very importantly that we need to not be complacent or relaxed about it if we get to certain ages without having high blood pressure, because it doesn't mean that we'll never have it. That was a point that often would come across with my patients. They would say, but you know, doc, I've always had low blood pressure. How can it be that I have high blood pressure? But you've pointed it out to us quite importantly. Does diet have any role in my blood pressure?
Diet is very important. And the DASH program, Dietary Approach to Stop Hypertension, is a government program, experimental program, which they prove that diet works. That is a higher plant-based diet, more plant, less animal, and that means more potassium, and the blood pressure came down.
Right.
Vegetarians have lower blood pressures.
Okay. So you're telling us that the DASH diet, or the scientific way of showing it, is that plant-based diets are the best for preventing and also treating high blood pressure, and we need to come back to that just after our very next break. Welcome back to Life's Beat, and Dr. Scharfenberg, our expert on nutrition, is helping us understand the DASH diet, which helps stop high blood pressure. Tell us about the DASH diet in more detail, please.
Well, this was mostly plant-based. It did have some chicken and fish or turkey or something like that in with it, but not much. But it also had calcium. It had milk with the calcium. Now, if you had soy milk with fortified with calcium, that would do it too.
Right.
But the calcium is extremely important. Okay. Besides that, then they went a second DASH program. They started with lower salt, and that lowered the blood pressure even further. So these are important factors. Now, the plant diet is high in potassium.
Right.
That dulls the effect, attenuates the effect of the sodium. So that is extremely important. Now, let me give you one example where I have here some figures. A baked potato with skin gives you 7,882 milligrams of potassium and only 5 milligrams of sodium.
Wow.
But if you have 10 potato chips, you have only 226 milligrams of potassium, but 200 milligrams of sodium.
Wow. And that's before you've added all the other salt that you add on it.
That's right. Now, this is something. It makes a tremendous difference what farm your potatoes are in. So don't add too much salt to the potatoes, and the potato chips aren't the thing to do. Get regular baked potato with a skin, and that's good.
And eat the skin.
Yes.
You know, I think that's a very important point that you've brought out, the difference between the baked potato and the fries or the chips or whatever it is, and bringing a much more nutritious value to our lifestyle, and also in preventing the high blood pressure. You wanted to say something further on that?
Well, I want to say something about the oils.
Yes, tell us.
It's extremely important to get the right oils. The omega-6s, that's your linoleic acid, which is high in the corn oil and the sunflower seed and safflower oils. That's good. But most of us are getting enough of that. So the emphasis right now is on the omega-3s, the alpha-linolenic acid. And you need to get that from the canola oil, the walnuts, the flaxseed meal, those kind of things.
So it's the plant-based oils, excluding coconut oil, that are the ones that are going to be helpful in this program.
That's right. Particularly the omega-3s.
Right.
Because we're getting enough of the omega-6s. But it's limited what foods we can get that omega-3 in.
Right.
You see? Now, the non-vegetarian gets some of his in fish with the EPA and the DHA, that has a lot of those things in it, you know. That works too. But there's a little problem too. The fish with EPA have 5 and 6 double bonds in the molecule.
You're getting very technical, but does that mean that that's a problem?
That means it oxidizes more readily.
Oh, and oxidizes mean it becomes more harmful?
The more double bonds, the faster it oxidizes, so some studies showed that is a problem. So if you're worried about free radicals, I just mentioned that because that would be the problem with the fish.
Okay, so what you're telling us is that in this DASH diet, we need to stick to plenty of fresh fruits,
yes,
vegetables. Some of the vegetables obviously would need to be cooked. The potato would be baked.
Right.
And we would have salads. We would be careful again, so we'd have lots of mixed vegetables and fruits. Be careful of adding salt.
Right.
So that's the sodium chloride, which is a problem, because when the DASH diet was studied alone with the special emphasis on fruits and vegetables, they didn't have the salt decreased as much as in DASH 2, and when they decreased salt further, the blood pressure dropped even more.
That's right.
So we need to increase the intake of natural potassium in our food. We need to decrease the intake of abnormal intakes of salt or sodium chloride, and
the salt sodium chloride combination,
right,
seems to have a much stronger effect at raising blood pressure than the sodium by itself.
Okay, and we need to look at the kinds of oils that we take in as well. Does protein, just briefly, the kind of protein we take, does excessive protein have an influence on?
Well, of course we know vegetarians have lower blood pressures, so we think that has to do with the potassium.
Right.
But see, the animal products have a lot of protein in it,
right,
and less potassium. So you do have a problem with the animal products. More chance for atherosclerosis with those animal products.
Right.
And the combination of high blood pressure with the cholesterol in the diet, the combination is bad.
Right.
The hardening of the arteries plus the hypertension.
Right. And the excessive proteins can be harmful in the longer term towards kidney function as well.
Yes.
So that is a point to take into account. Tell me briefly, water. Does water make any difference at all?
Well, you know, it's interesting. There have been 2 top expert panels that said the average person gets enough water. And they said there's no imbalance in water for most people. They said it's no big problem. However, the Adventist Health Study showed, without any question, that those who drank 5 cups or more of water, compared to those who drink less than 2 a day,
right,
really had a much lower risk of stroke as well as heart attack, 40% less. So it was really worthwhile to get water.
So water actually lubricates our vitality, and it has been shown to actually decrease the amount of heart attacks and stroke,
yes,
and would fit in very well with a diet rich in vegetables and fruits and nuts, and so it's important to take in water. And when we come back after our next break, we're going to talk about some of the other factors that help in the control of high blood pressure. Be sure to come back when we're there.